Hello and welcome to this episode of On Geriatrics. Today we shall be talking about team care in geriatrics. All the good geriatric centers would have a team in place to take care of the elderly and their caregivers. Typically, the team would comprise of geriatricians, geriatrics trained nurses, physiotherapists, medical social workers, and dietitians. But depending on the setting, one can add other members to the team as well. For example, if a center is catering to the needs of dementia patients, then the services of a geriatrics oriented psychiatrist or a psychologist would be invaluable. In a hospice setting, to take care of the spiritual needs of the dying, a spiritual person, a priest, or someone like that would be very useful. It has been found that such a team approach greatly enhances not only the quality of care but also the outcome with respect to the quality of life for the older person as well as their caregivers. Now, what are the settings in which such a team is useful? The most obvious one is, of course, the hospital setting, where in the geriatrics outpatient department, such a team can provide its comprehensive service to the elders and their caregivers coming into the department. And should any of these require admission in the hospital, then the team continues to provide that care for the inpatients as well. Not only that, the team in the hospital can provide its services and expertise to the management of patients admitted in under other specialties within the hospital, be it surgical specialties or other medical specialties, and help in their recovery, rehabilitation, etc. Apart from the hospital settings, a hospice is another obvious place where a team would be very useful. Old age homes, retirement homes would greatly benefit from the presence of a geriatrics team. In fact, if I were to choose to live in a retirement facility, the first thing that I would look for is how good the geriatrics team there is. I would not look at the infrastructure or how luxurious it is, because I know that that is what makes the real difference for the older person living in such a facility. Another very important setting in which a team can be very useful is community geriatrics. So, a team can be set up for a locality to provide not only outpatient services for people visiting the center, but also can help the people, the older people, stay at their own homes in that locality, and the team members can go and provide services there. The elderly always likes to be in their homes till the very end. Nobody likes to go to another center or die in a hospital. And if we can keep them at home and provide the security and safety to be at home, there can be nothing better than that. In my experience, I have spent nearly a decade as an internist, or a physician as we call the specialty in India, looking after both the young and the old. But after my training in geriatrics and when I started applying those principles of geriatrics in the care of the elderly, I found a profound difference in the outcome. And when a team is working with me, I found the effects were almost magical in the way the patients and the caregivers were benefited. In fact, I remember the days at Amrita when, after we had introduced the geriatric service and we used to be consulted by other specialists to look after the elderly admitted under them, the floor nurses used to be amazed at the transformation that our team could bring about in the overall quality of life and recovery process of the patients and many of these patients could be discharged much earlier than they would otherwise have been. And on follow up too, we also got involved in their follow up to provide ongoing care. In my next video, I shall explain the role of each individual discipline in the team. Till then, goodbye.